Welcome to the What If It's Not Depression podcast. I'm your host, Dr. Achina Stein, and today I am interviewing a great person who I met recently in our recent conference, and he is going to talk to us about metabolic issues related to weight. Stu Schaefer is a 20-year-old award-winning celebrity weight loss coach. He specializes in helping people put their body into a thermogenic state, so they burn fat 24/7 and lose weight like they did in their 20s. Stu struggled with anorexia, by the way, in his teens, and I hope he's going to let us know a little bit more about that, since I have a number of patients in my practice that have anorexia. And when he overcame his eating disorder, he realized he wanted to help people create their perfect body in a healthy, sustainable way. That's the key word there. Since then, Stu has helped thousands of people transform their body and empower themselves to create massive success in their life. He is also great with technology and automating systems, and he's helped me out with my technology barriers that I've been dealing with lately. So I appreciate that, Stu. So if you enjoy this episode, please click the like button and subscribe. Welcome, Stu.
Oh, thanks for having me. It's going to be a lot of fun today.
Yeah. And I just want to dive right in because I have 1,000 questions for you, and we have limited time. And I know I could talk to you forever about a lot of things. So I just want you to start with your life story and with anorexia, because I just found that so intriguing. I think it's so good to talk about that because I don't think enough people learn that, wow, you can actually recover from anorexia. You know, most people have a dismal idea about that kind of disorder, and it's a very scary disorder to have sometimes because you can die from it, and you have heart conditions and things like that. So tell us more about that.
Yeah, I'm happy to. Now, I just want to make one little correction from the intro. You said that I'm a 20-year-old trainer. I'm actually a 20-year award-winning trainer. I've been doing this 20 years. I'm not 20 years old. Okay. I just wanted to correct, because people are probably listening going, oh, he's 20. And then I'm about to say, I've been doing this 20 years. And they'll be like, he's been doing it since he was born. No, I've been doing this 20 years. I am not 20. I'm a little bit older than 20. Just wanted to correct that. So,
thank you for correcting me.
And yeah, so when did in high school, my freshman year, between 8th grade and 9th grade, I developed anorexia, and it was a result of me having a very traumatic experience in my life. What had happened was, on my 13th birthday, I had broken into a house with a couple of buddies, and it was actually a person I knew, a friend, and his dad pressed charges, and I had to go to jail. And when you're 13, any little thing is like the end of the world anyway. Okay. Well, this seemed like the real end of the world. And, my parents didn't trust me. The community labeled me as a criminal. All the friends that I thought were my friends weren't actually my friends. And I felt very lost and very uncomfortable. I had depression. I had anxiety all the time because my world had been rocked. And the way I dealt with it was I became anorexic. And that was probably a little bit of a self-esteem issue, obviously, but also a self-punishment issue. And so there would be days that I would eat an apple all day long, and that was it. And you have to remember now, this is the years when we develop as human beings physically. And so I was malnutrition while I was in the developing stages, and it does a lot of negative things to you. Well, finally, what had happened was I had a nervous breakdown. I was in 9th grade English class, and we were doing Shakespeare, and I just had this, it was like everything seemed so overwhelming. I was obsessively working out, trying not to eat anything. I thought I was fat. I hated what I saw in the mirror, and everything just crumbled. And that was a good thing, because it forced me to acknowledge something was wrong. I don't know that my parents ever knew what was going on. They knew I had a breakdown because I was in my room, like in the fetal position, crying, not kidding. But I decided to follow a program. Now, this doesn't always work for people who have an eating disorder. In fact, a lot of times it can make it worse. Okay. But it worked for me because what I did was I said, okay, I'm going to follow this program because I believe it's a healthy program. And for 30 days straight, I did follow it, but I had anxiety all day, every day, because every time I ate, I was sure I was going to get fat. And I was just, I would look at myself in the mirror every day, all the time, thinking I was getting fat. Well, after 30 days, I didn't gain any weight. I didn't get fat. In fact, I felt better. I even think I looked better because my body was actually getting the food it needed, and it broke the false belief off. Okay. And that was the moment that I broke free from the eating disorder. It was not the moment that I broke free from the negative body image. Okay. But I realized in that moment that that was actually the moment I decided to become a health coach, because my confidence started going way up. I started feeling way better, and I could see both sides. I could see when I was sick, and I could see getting healthy and how quickly it happened in 1 month. I was lucky. And so I thought I can relate to people who have these negative body issues, or they are anxious. I mean, here's the thing, Achina. I would be watching, and the internet was new back then. Okay. But I would be trying to look at books and watch things and research, and I would just feel so overwhelmed. And I thought, well, I don't know how to eat. I don't know how to do this. There would be days I just wanted to hide under my covers because it just felt so overwhelming. So I get that, which is why I do what I do. I simplify things. Okay. Well, now fast forward, because this is how it applies to people, to regular people, or people trying to lose weight. Is, I now had been training for a few years. And by the way, when experts like trainers and health coaches get trained, they still teach calorie restriction, which is why most people don't recommend. And I know this show is not about eating disorders, but this is why most people don't recommend someone with an eating disorder do a program, because programs all focus around calorie counting, and that's what typically makes things worse. Okay. However, that's not how you should do it. And we're probably going to talk about this. I was training for a few years, doing very well with my clients, but they teach you calorie counting in all of the classes. That's how they teach you. In fact, they'll tell you that's the only way to lose weight. It's not. And I'm going to explain that in just a second, because I was working and I was in my office one day finishing up lunch. There was a knock on my door. And when I looked up, I saw this woman. Her name's Ashley. And she was kind of still huffing and puffing, still red. She had just finished a workout. And she said, Stu, I really need to lose 30 to 50 pounds. And I've tried everything and I can't lose a pound. And I thought to myself, now I'm in my 20s at this point. I thought to myself, and I was a little arrogant, oh gosh, this woman is probably just eating too much and she just doesn't realize it. And she thinks that she's eating fine, but she's really not. So I said, look, I can help you. No problem. All my clients, they're getting results. Well, 5 weeks later, we tried the calorie restriction, more exercise. We even tried things like Atkins, paleo at the time was hot, the zone diet, the Mediterranean diet, the South Beach. I mean, we tried everything. She had tried everything. I was willing to try everything. At 5 weeks, she hadn't lost a pound. Okay. Well, now I'm in my office, devastated. She's sitting across the desk from me crying. I'm thinking I might as well just give up this profession, because I'm thinking I don't even know what I'm doing. I thought I did, but I don't.
Right.
So
Right.
I said, okay. I said, Ashley, I'm not going to let you go. I'll work with you for free until we figure this out. I'm figuring this out. I didn't like to fail. I still don't, but I was like, I'm refusing to throw in the towel. Well, I went on this 2-week massive deep dive research quest. And after about 10 days, I figured out what was going on. Okay. And it's something called repressed metabolic syndrome, or RMS. Now, what is repressed metabolic syndrome? This happens to people who have, something like anorexia. This happens to most people who diet or who over-exercise. And what happens is you shut your metabolism down. You don't eat enough, or you work out too much, or a combination of the two. And since Ashley had done all these different diets trying to lose weight, what would happen is she'd lose 3 to 5 pounds. Her body would downgrade. She'd go into this catabolic state, okay, where the body is hyper stressed. It's actually storing fat, burning muscle. Then she'd gain the weight back, whatever weight she'd lost. And then over the course of the next year, she'd gain 7 to 10 pounds. Well, I go back to Ashley and I said, I figured out what's going on. I explain everything to her and I tell her, we need to eat more and exercise less. And she looks at me like I'm nuts. What? Are you crazy? She goes, I can't lose a pound doing all this. She was exercising between 90 minutes and 2 hours a day, eating 1,200 calories or less, really tracking everything. She says, there's no way I'm going to blow up like a balloon. I said, trust me. I explained everything to her. I finally convinced her to try it for a week. Okay. So the first week she dropped 2 pounds and she's still not that excited. I'm excited. I'm going, yes, this is working. She's not. She says, this is what always happens. I'll lose 2, 3 to 5 pounds. Then I'll just watch. I'll hit a plateau, gain it back, and then gain more. This did not happen this time. The next week she lost another 2, and the next week and the next week. And 12 weeks later, she had lost a total of 37 pounds. And she's looking at me like, how is this possible? I'm eating 50% more than I was before. I'm exercising less than half. I got her down to 45 minutes a day instead of 90 minutes to 2 hours. And my body's losing weight. This is impossible. Right. I said, no, because of what I had discovered, right? What were you going to say?
Well, I have so many things that I want to say. So I was like, to interject, I didn't want you to stop talking, but so a couple questions. First of all, that limited belief, I want the audience to know, or that false belief that people operate from is huge. You really need to look at the false belief that a person operates on, and you can make a shift just by being aware that you're operating from a false belief, which you beautifully demonstrated. The other question I had, or comment I had was that, or a question actually, is when you're in that place where you're exercising a lot and really restricting your calories, are those people always hungry and always tired as well?
No, this is a good question. Because what's interesting is I've had clients, when you have repressed metabolic syndrome, one of the symptoms is you're not hungry because you've repressed your metabolism. Now, your energy is low. That part is generally true, although it's not always true, but it's generally true. But normally you don't have an appetite. Now, this is really interesting because not long ago, a client found me online. She saw my Instagram page. And her name's Lachlan, and she came on my podcast because she felt she fit this bill perfectly. I did a post explaining the dangers of overexercising, and I did explain what repressed metabolic syndrome was. And she said, I think that's me. I said, well, let's chat really quick. So we got on the phone and we were chatting. She said, I work out 2 hours a day and I only eat 1,200 calories. I monitor everything. Just like Ashley. Okay. Mm-hmm. I said, well, that's really interesting. She goes, yeah, I have to sign up for marathons because it's the only thing that keeps me going. She goes, I'm moody. I'm frustrated. She was losing her hair. She's in her 50s or 50. And she goes, this sounds like everything you're saying is what's happening to me. And I said, yes, it is. Well, I increased her calories. Now, I don't count calories. I don't think anyone should count calories. I'm saying this to give an example. Her calories increased by 50%, 50%. And she went from 2 hours a day to 30 minutes a day of activity. And she lost 18 pounds in 12 weeks. Okay. Her hair grew back, no more moodiness, energy all day long. And she said, I have so much more time to actually enjoy my life because I'm not spending my whole life exercising. This is amazing. And this is what happens. Now, the beautiful part, if someone's listening like, oh, does this only work with people who aren't losing weight? Well, no. See, once Ashley lost the weight, I thought, well, geez, if it worked for someone like Ashley, it was impossible to lose weight, how would it work for my other clients who are already losing weight, doing a calorie restricted diet? So I said to all my clients, hey, I just figured out something new. Would you be willing to try this? Yeah, absolutely. Well, here's what happened. They started losing weight faster, no more hunger, no more cravings, way more energy. And here's the kicker. They never had a downgrade in metabolic. So they never had to restrict ever more. They could maintain their results forever because there was no restriction. And later on, I found out their hormones were balancing out as well. Now, this is key because a lot of people that have anxiety, depression, can't lose weight, are not eating enough and have this repressed metabolic syndrome. When you throw your hormones out of whack, that can be a huge, as you know, a huge trigger for anxiety and depression, mostly anxiety. In fact, I was just talking with a trainer who works at the same gym as I do, and she had anxiety after college. And it was because of two things. She wasn't eating right, and she had an undiagnosed gut issue. Okay. And when you eat right and you put yourself in this thermogenic state, which is what I'm describing, and your hormones balance, you can also reverse gut issues by choosing the right foods. And this is something that not 1 in 1,000 coaches discusses, because quite honestly, they don't realize. I've learned through 20 years of trial and error, like with Ashley, with devastating failures and trying to figure this out kind of like, as you'd call, on the street. And over those years, I found out that there's healthy foods, Achina. There are healthy foods that actually aggravate the gut issues, that actually can cause you to gain weight, that can aggravate autoimmune antibodies. Things like spinach, okay, things like kale that we're taught, okay, you need to eat more veggies. You should be eating nuts and seeds. You should be eating nice whole foods. Well, sometimes, yeah. And sometimes, no, it can make things worse. And so having it, yes, exactly. And that's like, no, like I said, not 1 in 1,000 coaches knows about this because they're not getting their hands dirty. They have, you know, okay, don't get me started. I'm sorry.
Well, I want to comment on that. I totally agree with you, because in my boot camp, you know, I have a private practice, one-on-one patients, and a lot of times people want to have testing done right off the bat, and then we get the results and we treat the gut. But I found that in my boot camp, it's a 12-week online boot camp where the goal is really all health coaching and to change habits and to change your diet, get movement in place, stress reduction. And I have found that in those 12 weeks, there's so much that can change in just doing those things that we don't have to do testing for the gut. And because what you've changed does affect the gut microbiome, and it does put it back into balance to some degree, because now you're eating the right foods. And it is figuring out what foods are right for you. I have a patient who had SIBO and was given all the wrong foods, and she got worse. And no one even talked to her about SIBO. So she got worse by adding all the vegetables instead of being on a low FODMAP diet. So I agree with you that so much can happen that you don't even have to have testing or to even treat the gut.
Yeah, now that's a good point. I mean, and SIBO, I had SIBO, by the way. And boy, it's you know, SIBO, Candida, leaky gut are so common these days, as are thyroid issues with women. Now, why? Well, you know, I'm going to just come out and say it. The keto diet is the fastest way to wreck your thyroid. Why? Because when studies have proven this since the 90s, okay, since the 1990s. So we're looking at 30 years here, that if you don't consume enough carbohydrates for a long enough period, you'll cause something that's called, this is a medical term, diet-induced hypothyroidism, okay? This is when you don't have enough carbs, it downgrades your T3 production and you get hypothyroidism. Now, same thing happens if you get too high of fat consumption, except it downgrades your T4 levels. So in the last 3 years, I've seen more women with hypothyroidism than I did the 17 years combined before that, because everyone's doing keto. Now, women tend to be a little bit more sensitive hormonally than men, but you can reverse it. That's the good news. And I can't tell you how devastating that can be, especially with anxiety or depression, because your thyroid is essentially the control center for all these things in your body. And it's just very detrimental. So I don't do a lot of testing either, but here's the interesting part. The reason I don't is because I've developed this, what I call high risk protocol over the last 20 years, where regardless of if you have a gut issue, a thyroid issue, or an autoimmune disease, the same foods affect you, period. Now, a lot of these foods will not show up on a food sensitivity test either. And that's key because it's not a food sensitivity. The food's interacting poorly with either antibodies possibly in your body or with your gut biome, period. And that may not show up on a test.
Right. Right. Yeah, no, those are excellent points. And you're right that being on a specific diet, especially long term, can be a problem. I strongly believe that diets should evolve over time. And you're absolutely right that restricting carbs can, and I see this profile, this type of thyroid profile that you're talking about in many people who have anorexia, right?
Yes.
It's really,
Yes.
really common. And I call it the body going into hibernation of sorts, right?
Mm-hmm.
That body shutting down, right? The thermogenic piece of it that you're talking about. So
Right.
yeah, so I've always called it hibernation, but maybe the thermo, what is it? What did you call it? Resistant or
Repressed metabolic
repressed?
syndrome.
I'm not familiar with that term. So you have taught me something new, Stu. You really have.
Yeah. And the only way to get out of that is to put your body into the thermogenic state. Now, what is the thermogenic state? That's accomplished when you eat more and you exercise less. Now, I shouldn't just say less. It's like exercise should be viewed as a prescription. Okay.
Absolutely.
When you go to a doctor, if they give you a prescription, if you don't take enough, it doesn't work. If you take too much, you can die in some cases. Okay. So exercise should be viewed the same way. It's not more is better. It's not less is better. You want to get the exact right balance that gets your body to do what you want it to do and makes you feel how you want to feel, period. And so I just can't emphasize that enough. Now, the thermogenic state is not like a ketogenic state. The ketogenic state is a survival mechanism the body has for when it's in times of starvation. We were never meant to live in a ketogenic state. The thermogenic state, on the other hand, is the way the body prefers to be. So it's very easy to get into a thermogenic state. And once you're in the thermogenic state, it's very easy to stay in the thermogenic state. And here's the beautiful part. When you get in the thermogenic state by eating correctly, and I can talk about this if you'd like.
Yes.
And by exercising appropriately, 5 things happen in this order. Number 1, as you referenced earlier, your energy goes through the roof. I had a client, and after the first week, we had a coaching call on a Monday. And I said, "How was your weekend?" And she said, "Oh my gosh, I cleaned my whole house. I even unpacked all the boxes that have been in the basement for 2 years. I can't remember when I had this much energy. This is incredible." So that's the first thing that you notice. The second thing, your body starts burning fat constantly all day long. A lot of times the keto people or fasting people will say you have to get into this special state, and I'm a fat burner, and you eat carbs, so you're a sugar burner. Ha 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 ha. Well, they really don't know what they're talking about when they say that, because you can eat carbs all day long, but if you combine them with the right foods and you eat the right types and you time them correctly, you can still cause your body to burn fat all day long and while you're sleeping. So that's the second thing that happens. The third thing is your appetite normalizes. This means you actually get hungry when it's time to eat, but you're not hungry when it's not time to eat. It's a normal appetite, which a lot of people don't have anymore. The fourth thing that happens is your cravings vanish because you're not restricting anymore. And the fifth thing, and this is really key, your hormones balance. And I'll tell you the order they balance in. It's very fascinating. Almost immediately, your insulin and blood sugar will balance. Okay. Second thing that balances within a couple of weeks is your cortisol levels. Okay. People don't know this, but when you fast or when you skip meals, it actually elevates your cortisol levels.
Yeah, it's stressful. And yeah.
Yes. The third hormone that balances, and this balances after 4 to 6 weeks, is your the thyroid hormones. Okay. Now, along the way, 2 other hormones balance called ghrelin and leptin, which are either your hunger hormone or craving hormone and your fullness hormone that also, by the way, triggers the body to burn fat. And once those hormones balance, your other sex hormones will balance, your estrogen, progesterone, and testosterone, and they'll do it naturally because everything else is ready. So the body has the ample resources to go in and balance those other hormones.
That's fantastic. That's really great news. Yeah. Wonderful. So why don't we just dive into some of the things, like, you said there's 3 food mistakes that 68% of women make that cause the fatigue, the weight gain, and even anxiety and depression.
Yeah.
Can you talk about some simple tweaks that people can make so that they can get started on this path?
Yeah. The biggest mistake most people make, especially in America, is they skip breakfast. Okay. One of
I
the
agree.
biggest mistakes. And it's because they're trying to do this fasting thing and they don't realize it's actually damaging your body. So that's number one. Never skip breakfast. Never. The second mistake that people make is they eat a lot of carbohydrates by themselves and they don't realize the implication that they have. And I'll give you an example. Most women, in the past, and I'll give you a specific example. This was many years ago. This was probably 2010 or 2011. After I had worked with Ashley and figured this stuff out, this woman had come to me and she was very intelligent. She was a CEO or one C-level, something C-suite level executive at a company. She was very type A, very put together, very intelligent. And she said, no matter what I do, I cannot lose weight. I need to lose 15 pounds. It's on my belly. I cannot lose this to save my life. I've tried everything. I said, okay. I said, I believe I can help you because I had now had a history. And the first thing I had her do was write down what she was eating. And I immediately saw the problem. She was eating a lot of fruit, and a lot of the fruit was by itself. Now, let me explain something. Fruit is a healthy food. Okay. However, it has fructose, which is called a monosaccharide. This means it's a very simple sugar. Right. I don't care who you are. If you eat fruit by itself, it is going to spike your insulin and have the same effect on your body as if you eat a cookie, period. The only difference is cookies are processed, fruit is natural. That's the only difference, right? Period. But it's going to cause you to gain weight, specifically body fat. All I did was 2 things with this particular woman's nutrition. She stopped eating fruit on its own. Instead, she combined it with the right foods, and she stopped eating as much all through the day. That was it. And within a month, she was down 6 pounds. And within 2 months, she was down 14 point something pounds, essentially the 15 pounds she wanted to lose. And she said, oh my gosh, if I had known it was this simple, I'm kicking myself for not finding you sooner, but I'm so glad that I did because it's so simple. It's easy to maintain because we made minor adjustments.
Right.
So that's mistake number 2. Mistake number 3 is essentially eating carbs late at night. Now, this is really interesting because little do people know. And again, I don't know that 1 out of 1,000 coaches even understands how the body works. Because if you went to 100 coaches and you said, hey, how do you lose weight? 99 out of 100 of those coaches are going to, even doctors, by the way, are going to say the only way to lose weight is a calorie deficit. They won't even say that's one way. They'll say it's the only way. Now, we know that's not true. Now, every food has a different chemical reaction in the body and it affects your hormones differently, period. So here's what little known facts that nobody knows. Okay, if you got 1 out of 100 knows this, but if you lined up 10 of those people, now you're talking 10 out of 1,000, maybe 1, 2, or 3 out of 1,000 actually understands how the body works through the day, meaning your cortisol levels are higher in the morning. They're supposed to go down at night. Your metabolism is slower in the morning. It peaks through the day. It goes back down at night to get ready for the sleep cycle. Your insulin sensitivity is high in the morning and it goes down as the day progresses. So if you're looking at these things, you need to eat differently in the morning than you do in the middle of the day, than you do in the evening. And what do most people do in the evening? They have a big meal, lots of carbohydrates, typically as a dessert and or alcohol. Right. And so they flood their body with carbohydrates and sugars. The body has nothing to do with it because it's trying to downgrade into a sleep cycle. And so it ends up storing it as body fat. That's the fastest way to gain body fat. So those are the 3 top mistakes. Okay. Skipping breakfast, eating carbs, specifically like fruits, all day long without combining them with other foods. And 3 is having too many carbs at dinner.
Right, right. I completely agree with you. You're preaching to the choir here. I talk a lot about how, your body is supposed to get ready to go to bed. And so it's almost like if you were in a factory that you started turning on some machinery in the middle of the night, and so you have to wake up parts of you to be able to digest that food that you're eating so late. And just like if you had a party of 100 people and only 20 people showed up, what would you do with all the leftover food? You'd put it in the freezer. So your body is going to convert all that food into fat. It's the same thing as putting it in the freezer. And that's what your body is. It's a freezer when it comes to fat. So yeah, I completely agree with you on all of these points. So what foods would you say can you give some examples of the types of foods that you would combine with fruit if you wanted to continue eating fruit?
That's a good question. So I'm going to actually start by telling you what not to combine.
Okay.
Because it's easier. It's easier. The worst combination for fat loss and for health is combining fats and carbohydrates. Okay. And I'll give you some examples. Fruit with nut butter, or fruit with nuts, or avocado toast, or macaroni and cheese, or peanut butter and jelly sandwiches. Those are kind of the worst possible combinations you could have. Now, what are the best? Well, typically you want protein. You need a certain amount. Now, how much? Everyone always sends me hate mail on my podcast because they say, you're not telling us. Well, that's because it depends on the individual, right? And it depends on your body weight, your lean body mass, and a couple other factors. And so I don't want to be careless and recommend something and someone tries it and then they go, no, it made my health worse or this or that. So you got to be careful, but you definitely want protein. Fruit is better eaten in the first half of the day. And you want, if you can get some types of better fiber. Now, see, some fruit has fiber and some fruit doesn't. Most people don't know which is which. If you're listening to this and you want a shortcut, the best fruit to eat, the safest fruit to eat is berries. Okay.
Right.
And
that's what I usually recommend.
Raspberries, blackberries, blueberries. Strawberries can be high risk. Okay. A lot of people don't know this, but strawberries can be one of those high risk healthy foods that can trigger autoimmune and other gut issues. So I recommend the other berries most of the time. I always suggest everyone has protein at every meal, period. And, the amount is to be determined based on you. And the type is important too. Not all proteins are created equal. Plant-based proteins don't do much for you. Okay, they're not complete. We're going into a plant-based fad. Everyone's starting to shame, meat shaming and everything. But the fact of the matter is plants do not have a complete protein. You have to try to combine, right? And when you combine, let's say you have rice. And if you look on a package of rice, it says it has like 4 grams of protein. Let's say you look at beans and the beans say they have 8 grams of protein. If you combine them, it's not 12. Okay. It's less than 4 because not all of the protein from the rice is going to match up with the protein in the beans. It's probably 3. So, but how many carbs do you have now? Probably 40 or 50 grams of carbs. So what the problem is you have this massive carbohydrate meal with a little bit of protein, and that causes a spike in your insulin, which causes you to almost immediately store body fat. Just how it goes. Okay. And this is why things get so complicated. And this is also why a lot of people can cut calories and still gain fat. The problem is when they cut the calories and they cause the repressed metabolic syndrome, they burn muscle at the same time, and then they really wreck their health. This is a very dangerous trap that a lot of people fall into.
I agree. No, it's really, I love the way you put all the pieces together and really drill down to actual amounts of protein and carbs, especially in these non-meat sources. So I'm assuming you're talking about meat sources when you talk about protein.
So you need it from an animal. Okay. Anything from an animal is going to be a complete source of protein. Now, here's another problem is we have more people than ever before who are lactose intolerant on some level. And dairy is one of the main culprits when it comes to problems with the body. Okay. Whether it's a skin issue or a gut issue or whatever. And so if you look at 90% of the bars or shakes or things out there, they have whey protein because it's cheaper and it's readily available. And when you consume these types of things, it is bad for your body. So you have to still, that's the question then is, well, where do you get the protein? The other thing you have to take into consideration is the fat content in these foods. Now, fat alone is not a bad thing. Okay. I'm not saying that you should cut out all fats. However, this is rarely talked about, but very important. Saturated fat, which is the fat found in animal products, will actually dull your muscles' insulin receptors. Now, why is this important? Because that causes insulin resistance, which is another massive problem. And I'll tell you why. It goes back to keto again, because half the people that do keto do a vegetarian version, and the other half do an animal version, and they're eating things like bacon and ribs and all these fatty meats. And they don't realize it, but they're causing their body to become insulin resistant. And then when they eat any carbohydrates again, or they stop doing the keto, they blow up like a balloon because they've, unbeknownst to them, made their body insulin resistant. And now when they do eat any carbs, it shuttles them, the glucose molecules, straight into the fat cells. This is where having a system or a coach or getting something tailor-made is so critical, because every individual has a different history of what they've done. They have different goals, and their body itself may be different. You might weigh, I don't even know, I'm not going to say any weight because it'll get me in trouble no matter what I say, but you have a certain weight and you have a certain amount of lean body mass or muscle.
Right.
You're very different than someone else who has completely different levels, and everything has to be based on that. The other thing I've noticed is everyone reacts a little bit differently, especially to these high-risk foods we're talking about. You know, I've had clients where I have a client right now. Her name is Kathy. She's 52. She tried to lose weight for 15 years. She said, I've tried everything, Stu. Why do you think you can help me? I said, because I've worked with people just like you. Mm-hmm. Well, we cut out some of these high-risk foods. Now, we found out that there were 2 foods. In the first 3 weeks, she lost 9 pounds working with me, and she lost about 26 pounds over 12 weeks. But what happened was we found out there were 2 specific foods. Now, there are probably more. Mm-hmm. In fact, I know there are. We just haven't pinpointed all of them. Mm-hmm. But there was 2 specific foods causing her to gain weight and preventing her from losing weight. And it was tomatoes and hummus, chickpeas. That's a high-risk food. And as soon as we cut those out, wham, she started losing weight very easily. Now, she's been to Paris, the Swiss Alps, other excursions, and she has been able to maintain her results and totally control her body, whether she wants to drop her weight more or maintain, because she understands now how the food works with her body. And so she can make those educated decisions. And this is a critical concept, is not just how do I lose weight? It's no, how do you maintain it? How do you control your body so that if you want to splurge, you can, and you know how it's going to affect you? Also, your anxiety and depression. Certain foods will trigger the anxiety and depression. And you have to know, okay, yes, but it's my 50th birthday and I'm here in Cancun and I'm going to drink the alcohol and I'm going to have these certain things. I'm going to do it. Fine. That's fine. That's 100% realistic. But as long as you know what you're getting yourself into and you have a plan for when you finish, right, that's the difference. That's the difference.
Right.
Okay.
At least the awareness gives you choices.
That's empowered choices.
Yes.
Empowered choices. Yeah.
Absolutely. Absolutely. So how do you figure out which foods are good or bad for a person? Is this through testing? Is this
it's through 20 years of trial and error and failing miserably. Here's the thing. So let's say if someone's listening right now and you're trying different things and you've tried for a while, and maybe here's the most typical thing I hear from women, and it's not bad. It's just what I always hear is, yeah, back in the day, I did Weight Watchers and it worked great. And then I tried to do it again. It really didn't work very well. And now I just can't get the weight off no matter what I try. In fact, I keep gaining weight slowly. What is wrong with me? If you're in that boat, the odds are you have some sort of a reaction to one of these high-risk foods that I keep mentioning. We just don't know which one. It could be 1, 2, 3. I've never seen anyone allergic or sensitive to more than 3. 3 was the max I've ever seen. And I've been doing this for 20 years. Mm-hmm. So how do you go about and find it? Well, I can look and say, okay, we need to, this is a high risk, this is a high risk, this is a high risk. Let's pull these veggies or let's pull these fruits for a week and let's see what happens. Oh my gosh, I just dropped weight. I've just, this is crazy. Okay, let's add one of them back in. You add one back in. I still lost weight. Okay, it's probably not that one. We add another one back in. Oh, I gained a pound. It's probably that one. Okay.
Right.
I have a client right now. I won't share her name because I didn't get permission to share, but she recently signed up like 3 weeks ago. No joke. She was like debating. I don't know. I've tried everything. I have this naturopath. I've done this. I have this doctor. I don't know. Can I call your clients? I go, no, I'm not going to give out their numbers, but I have a lot of clients who've given me an interview on my podcast. So I said, here, I'll send you all their interviews. You can listen. And if you think it's going to be a good fit, then do it because I know I can help you. She's still wavering. What about this? Can we do a trial period? I go, no, because that means you're not in it. You got 1 foot in and 1 foot out. It doesn't work if you have one. You got to do it. She go, okay. So finally, after lamenting, okay, I'll do it. Okay, we're in I don't even know where she started March 11th. We're not even in a full month yet. Okay. Right. She's down 6 pounds. Okay. So she's losing about 2 pounds a week. And I was just talking to her right before talking with you. And I said, aren't you glad you've just jumped in with me? She's like, I'm so glad. This is actually way easier than I thought. And I'm getting more results than I've gotten in years. And this is what happens. Now you're asking, well, how do you know what foods? Well, there's probably 30 different foods. And what happened was over the years, I'd work with someone who had Hashimoto's. Okay, well, I didn't know what that was initially. Well, what they found out was and this was when they had the big kale kick. Do you remember that? Yeah. Everybody was putting kale in everything. And that was causing her to gain weight. So I thought, well, that's weird. She said, yeah, kale and spinach caused me to gain weight since I have Hashimoto's. Okay. Then I would work with another woman with Hashimoto's and we'd find out things like pineapple or strawberries would cause her to gain weight. And I would make this running list. Then I would find someone who had candida, right? Okay, well, beans are a bad idea for candida, obviously. And I would find these other foods that exacerbated it. Then there would be someone with a thyroid issue or no thyroid. Wow, certain foods interact with the thyroid. And over the years, I found out that their same foods would always end up showing up, whether you had an autoimmune, a gut issue, or a thyroid issue. And so I just deemed it the high risk list of foods. And there's a handful of fruits, a bunch of vegetables, things like beans or lentils, different nuts and seeds. So when I see someone and I'm looking at what they're eating, I can see any of those high risk foods show up. And I say, look, you're eating 3 of these high risk foods. Let's pull them for a week and see what happens. Bam. They start losing weight. They feel way better. They start sleeping better. Okay, let's introduce them one at a time and see if we can't pinpoint it. And it's a very simple and quick process, very effective. And this is it, right? That way, you know for sure, without doubt, this food my body doesn't like. It causes me to gain weight, or gosh, and some of those foods, Achina, as you know, those are the ones that can cause the anxiety, because what they're doing is it's not the food itself that causes anxiety. It's causing a bad chemical reaction in your body.
An immune reaction of sorts. Yeah.
Yes. Yeah, exactly. And that maybe isn't quote unquote anxiety, but it makes you feel like it's anxiety. Right. And so you go, oh, I think I have anxiety. No, that's not the case. It may just be a bad interaction with these foods. Right. And if you just cut them, all those bad feelings will go away.
Sometimes people have a wave if they think that they're having a hot flash, but a wave comes over them.
Right. Yeah.
To a sweat. But that's an immune reaction. Yeah. I understand what you're saying. So you've basically created your own system.
Yeah.
With writing your own lists over working with people. I wonder I'm curious, is sesame one of those things on your list?
Sesame is one, chickpeas, peanuts, of course. That's actually becoming more of a common thing since so many people are using. I don't know. I don't know all of them off the top of my head.
Right. No, that's really great. Yeah. So it's almost like a personalized elimination diet of sorts, eliminating.
Yeah, but without doing a full elimination diet.
Right. I agree. Yeah, it's a personalized elimination.
Yeah, it's like a pinpoint elimination diet so that you don't have to give up many foods, just these potential high risk. And that way it doesn't feel like a big burden, because
Right.
if you've done a real elimination diet, those are hard. You're
Mm-hmm.
giving up 3 to 4 weeks of your life eating virtually nothing,
Right.
and then spending months trying to figure out, what could be causing stuff. Yeah.
Right. And like you said, some of these foods are considered healthy foods, so people eat more and more and more.
Right. Yeah.
Yeah,
I
you're
know.
right about kale and spinach being an issue with candida because they're high in oxalates.
Mhm.
So there's
But they're
real
also
reason.
they're
Yeah.
also a huge issue with people with Hashimoto's,
Mm-hmm.
because they can aggravate the antibodies.
Mm-hmm. Right. Absolutely. Yeah. So, wow, we talked a lot about a lot of things. And, I want to jump to, if you don't mind, to exercise. So you talked about how too much exercise can actually prevent weight loss and hurt your body. Can you talk about, why that happens and
Yeah.
how much exercise is really needed that it's actually needed in terms of creating the results you're talking about?
Yeah, without giving a background, there is a detailed explanation as to how I arrived at this, but we don't have time for that. And the long story short is, all my clients, and they'll lose 20 to 30 pounds in 12 weeks. Okay. 2 to 3 pounds per week, which is very fast. We only, and myself included, we only exercise 30 minutes a day, 6 days a week, period. That's it.
Mm.
And it's not high intensity interval training. Okay. Now, the reason that exercise too much will halt your progress and shut your body down, there's two reasons. One is, if you do too much exercise and you create too big of a calorie deficit, your body will shut down. You'll create the repressed metabolic syndrome, and you'll pull your body out of the thermogenic state faster than you can believe. Okay. The other part is, all exercise is stressful on the body, so it elevates your cortisol levels. The higher the intensity, the more elevation of cortisol levels you get. The higher the duration, the more elevation of cortisol levels you get. And so you have to strike the balance. And essentially it's 3 days a week of weights, 3 days a week of cardio. And the weight training is obviously always going to be high intensity. So that's going to have the biggest cortisol bump. But it also has tremendous benefits, okay, with metabolic and HGH and other hormones. So you can't do it all the time. You have to do it I like it every other day. So you get a day of rest, which allows the body to stay in a normal zone. Now, the reason I've done it this way is essentially to get to a person's threshold. What's the most you can work out without having a negative impact on your body? And this seems to always be the sweet spot.
Mm. Great, great. Yeah, you're right. We're running out of time. I want to know what your magic bullet is to reversing gut issues without cutting out any foods or doing an elimination diet. And then we'll end there.
That's fine. So, okay.
Yeah.
So not many people know about this, although it's starting to catch on. It's something called structured alkalized silver. Okay. This is very different from colloidal silver. It's also different from nano silver. But what happens is, when you get the right silver, and I do have my favorite brand listed on my website.
Mm-hmm.
It's the only one I've been able to successfully use that doesn't cause any buildup or acidity in the body. But silver is an antimicrobial. And when I had SIBO, I did an elimination diet. I tried natural antibiotics. I refused to do regular antibiotics. And the silver is what finally allowed it to just disappear almost overnight. And now I can eat anything, never have a gut issue. I take the silver routinely every day. It's something I'll take the rest of my life. It's so non-invasive. There's virtually no side effects. And it's like drinking water, a couple sips in the morning, a couple sips in the evening, and it cleanses out the viruses, the molds, the bacteria, the fungus in your body, and it does it in a big way.
Wow. Wow. I learned something new today. So yeah, whenever I do these interviews, there's always something that I've learned, but a lot of it is really, support of what I've been doing in my practice too. So, and what you described in terms of where people need to be in creating this thermogenic thermogenic state. I think I'm saying that word right. Thermogenic state that's what I'm doing. I'm following your plan to the most for the most part. So yeah, it's great. So you're confirming how what I'm doing for myself is right on target. That's great.
That's great. That's fantastic.
Yeah. So I really appreciate you. I love everything that you're saying. And I love that you're so passionate about your work and that you're so successful, and especially, showing that vulnerable part of you and sharing, how and what you experienced in childhood in your teen years. But the beauty of your story is that you were able to come out of it, and it really gives people hope that, wow, you had your lows, but look where you are now,
Yeah.
So I really, really appreciate everything that you've shared today. And I know people are going to love to hear this episode.
Great. Can I tell people how they can find me?
Absolutely. And I will also include it in the show notes.
Fantastic.
And yeah, I hope people will reach out to you. Go ahead.
So yeah, just my name, StuSchaefer.com, and I'll spell that StuSchaefer, StuSchaefer.com. And yeah, I would love to hear from them, and they can check out some of my free resources over there, and would be great. So
and
I really
listen to your
appreciate you.
podcast. Yeah.
Yeah, I really appreciate you having me on the show. This was really fun.
Great. It was lots of fun. Great. Thank you so much.